Why? Because if the things that are necessary to lay down new tissue and to heal damaged tissue can't get into the area, if they can't permeate through those tissues, you're not going to have good healing. It's simple as that. Now that's the connective tissue component, right? Um, is there a neurological component that anyone can think of involved with ankle sprain? Yeah, like anyone want to offer a suggestion? Like cerebellum? Cerebellum's important? Yeah. Which part of cerebellum? Vermis? And no. Right? You're thinking of lateral cerebellum, right? Quite lateral cerebellum, actually. Peripheral cerebellum. Cortex. What area of the cortex is involved with the ankle? With an ankle sprain. So you get an ankle sprain. You get a really bad ankle sprain, and you go to a doctor. He puts an air cast on it because you're whining and complaining. He feels sorry for you. So he says, "Oh, this person needs to feel supported." So I'll give him an air cast. Boom. Right? What happens to that ankle in the air cast? Does it move? What happens to the nervous system? What stimulates the nervous system? Movement. It's not moving. What happens to the nervous system in that area? Like it goes to sleep. It's not exactly that it goes to sleep, but it's kind of like that. It gets down-regulated, right? So now we've got our cerebellum, which depends on a certain amount of stimulation, and our cortex, depending on a certain amount of stimulation coming from that area, right? From the proprioceptors that are located in those tendons and ligaments, well, ligaments in particular, right? And it's feeding up to cerebellum, or not in this case, and it's feeding up to the cortex, in particular, the parietal cortex. Okay. Do parietal cortex have some role in eye movements? Which eye movements? Pursuits. So, this is a little clinical cue for you guys, right? Person has a really bad ankle sprain. Wonder if it's really affected their pursuit system in the parietal lobe of their brain. You can test pursuits. Oh, shoot, there's a change in pursuits. Well, we know now that this ankle sprain has affected the whole system all the way up to the parietal lobe of the head. Maybe you might want to work with that. Just something for you guys to think about. Okay. And regional, what are some of the regional implications for the ankle? Well, I think it's important for ankle sprain, if you want to think about effects to the sciatic nerve, or in terms of causation, what about something that's affected the sciatic nerve, right? Causing worse motor control in the area of the ankle. Although things can be simple, and there's no doubt about it that, like, sometimes an ankle sprain is just an ankle sprain. You always have to keep in your mind the possibility that, like, an ankle sprain is caused by something much more nefarious, right? So don't be afraid to, like, test motor control. Do muscle testing on the, you might not want to muscle test an area where there's been a bad sprain, but you can muscle test above it. Make sure the performance of the sciatic nerve, for example, is good, right? And if it isn't good, then you're thinking about entrapment. And if that's not making a difference, well, now you got to think about things that change the performance of the sciatic nerve. Can you get tumors in sciatic nerves? Yes. Neuromas? Bad. Can you get metabolic things that affect the sciatic nerve? Any metabolic things affect the sciatic nerve? Any metabolic things affect nerves at all? Not really. No, nerves are pretty tough, right? They just, like, you don't have to eat, you don't have to drink, you don't have to sleep. Nerves just keep on going. I know. Is this person a diabetic? Does this person have severe anemia? Does this person have a severe B12 deficiency? Right? Does this person have changes related to digestion? Are they celiac? Are they on the continuum of celiac? Now, how many cases of malnutrition do you think you see normally in your practice here in Canada? There was a period of time where you didn't see very many at all. So when I grew up, quand j'étais jeune, when I was a kid, right? We actually, in rural Nova Scotia, there actually were cases of malnutrition. Right? There's still a few of them, right? Because it's like a poor area, and like some kids, the parents would get sick, and then the kids wouldn't get fed for a year, like eating crackers and whatever they could catch for a year, right? So there were definitely cases of malnutrition. Do we see that now? And what's the name of it? We do see it now. And what we see are vegans. Someone who's on a weird diet, start thinking malnutrition. Someone who can't have a regular bowel movement, there's a problem. That's a big problem. Okay. Enough on that. I'm just trying to give you guys a way of thinking. So, and here we go. Here's something to think about. What's going on metabolically, what's going on in terms of the blood chemistry. You've got changes in blood sugar, you've got cortisol changes. So for example, if someone has severe adrenal fatigue, which by the way, that's a whole other lecture I want to give you guys about adrenal fatigue, because your adrenal glands are end organs. They don't make decisions, they follow orders, right? Like your adrenal gland is a modified thoracic ganglion, more related to the nervous system, right, than it is to the glandular system. So if someone has issues with blood sugar, right, like they're hypoglycemic, do you think you might see changes in their ligamentous structure? Absolutely. Do you think you're going to see changes in how they heal? Absolutely. Right? If cortisone or cortisol is your natural system of resisting inflammation, and you are not producing much cortisol, what do you think the chances of that person having an inflammatory condition are? Those chances are very high. So, can you look at someone and start to get a picture of that? Absolutely. Right? If this person has the affect of being hypoglycemic and they've got very, very pliable tissues on the edge of maybe hypermobility, already in your mind, you're creating a picture where you're thinking about things like what's their adrenal function, what's going on with their blood sugar. You can start asking questions. Remember, you got these things? They're called ears. They're for listening. Oh, I heard something good the other day. Why do you have 2 ears and 1 mouth? Because it's twice as important to listen versus talking. All right. Are there systemic things you can think about when you hear the term adrenal fatigue? I hope everyone in here at this point is familiar with the term HPA axis or HPTA axis, which is hypothalamus pituitary adrenal or thyroid adrenal axis. This is systemic, right? So where's your hypothalamus getting the information from, right? So it knows what to tell the pituitary to release. Well, it's getting it from the thalamus. And what's your thalamus? Your thalamus is a relay station in your brain. Information coming from all over the body, all different systems, from your blood, everything to the thalamus. And from there, it's getting relayed to cortex, to brainstem, to cerebellum, but it's everything's crossing through thalamus one way or the other. Very few things don't involve the thalamus. All right. All right, and some of this we've already talked about, but in terms of our palpatory experience or palpation experience, right? When we're talking about local, regional, systemic, someone has an ankle sprain, their tissues, their matrix might feel quite boggy. That's normal. If they feel quite boggy, what do? Squeeze it hard? Get the bog out? No. What do? What drains the matrix? The venal lymphatic system, right? So if their ankle's boggy, what's the next thing you touch? The area in around the knee, in particular the adductor hiatus. Very important vascular area. If that's boggy, what's the next area you touch? Another important vascular area. At the hip, the ligament of Hay and Allen Burns, or the falciform ligament of the thigh, and what's coming up through that? Femoral vein. What's going down through that? Femoral artery. Is that not an important vascular area? So that's boggy. Oh, shoot Zilla. Now what do we check? What's the next big area where we can assess the vascular system of the whole body, for example? The liver. Well, and the space around the liver, in particular diaphragm, because what's going on at T10? Depending on the person and their morphology. That's where your vena cava is going up. Inferior vena cava is going up through the diaphragm. It's hiatus. So if they got a major problem at T10, it's not the trapezius, what are you thinking about? What's in front of it? Right? That hiatus. Okay. And from there, what do you think about? What's the next thing you check? The right heart. And then what do you check? The lungs. And then what do you check? The left side of the heart. And we're just talking about ankle sprain. Now, I'm not saying you sit there for half an hour feeling the heart. It's in your mind. You know how to assess it. You know how to assess the diaphragm. You know how to assess these areas. What you have to get used to doing is remembering to do that. It's not like I sit there and assess the bogginess from an ankle sprain on every single person. You look and you quickly touch. I was at a biodynamics class recently with Dr. Jim Jellis, and I had a great line. Really loved it. He was talking to someone that said, well, I don't know how it seems like a treatments take a long time, blah, 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 blah. And he's like, you should have your diagnosis in less than a minute. Palpatory. Oh, shoot. Okay. It's like, well, what if it takes a long time for the treatment? He goes, then I would look at how you're waiting. What's the quality of your waiting? He goes, if you're not waiting well, it can take a long time. If you're really waiting effectively, really, really waiting, no rush, no impatience, no prejudgment, doesn't have to take a long time. Seems paradoxical, doesn't it? Well, I want you guys to think like when you're assessing someone, you shouldn't sit there and go for an hour, right? Touch, touch, touch. That's your palpatory assessment most of the time for the whole system. Because in your mind, you're thinking local, regional, systemic. All right, and the other thing to keep in mind is the ontology of the system. It's history. So someone who's 14 comes in and they have an ankle sprain and they haven't had a growth spurt yet, right? Because someone who pre-growth spurt and post-growth spurt, those are two different bodies. And pre-growth spurt of teenagers and during the growth spurt are two different bodies. Those are two completely different systems, chemically, physically, neurologically different. And if you treat them like the same, then you're going to treat them incorrectly. right? But in your mind, this person comes in, they haven't had their growth spurt, right? Maybe this is just an ankle sprain. Okay, next scenario. They're 60 years old, not in good shape. They've got stiffening everywhere. They're a guy, right? An ankle sprain can be indicative of very significant processes, and you should get very interested in the whole person. You should get very interested in how they're walking, how they're standing, how they're moving. Because now you should be thinking of, like, is this early Parkinson's, right? Is this neurodegenerative, right? Is this low testosterone? They've just lost all their muscle mass in their legs, right? Someone comes in, right, and they've got muscle in their upper body and they got no muscle in the lower body, and they got a bit of a gut, and there's like their legs are skinny, and they're older. You start asking about their testosterone levels, right? Because if they're not producing testosterone, they're not going to keep muscle. Muscle's protective. You guys even think about that? So much to think about. Love osteopathy. Okay, and we've already talked about ankle sprain in terms of the vascular system. So we've talked about, in a sense, stenosis, right? Like you can have spinal stenosis, right? And changes in the nervous system that end up as something that someone walks in with an ankle sprain. What about vascular stenosis? Can you guys detect vascular stenosis? Have you heard about vascular stenosis? Okay, so vascular stenosis is when you get stenosis of your vascular system. Sounds really easy, right? Can you test for it? Sure thing. You feel a pulse. You put your fingers on the femoral artery and you don't feel a pulse. There's two things that have happened. Either you've had to change that artery, right? Like it's now ligament. And if you think that doesn't happen, you are dead wrong. You want to feel a femoral artery that's been desiccated and turned into a ligament. Look for people who do a lot of biking. A lot of biking. And don't stretch. Some of those people will have lost their femoral artery. It's just recanalized. It's going to happen. It's going to work a different way, or it's very, very narrow. Right? So if they've got cold feet and they're a young person, right, and they do lots of biking, you should already in your mind be thinking, oh boy, I wonder if there's a change to the femoral artery. Okay. So now I put my finger on the femoral artery, right? It feels a little weak. Is there something else I can do to determine if there's vascular stenosis or not? Flex it. Bend that hip. Keep your finger on that pulse. Pulse disappears when you bend the hip. That's a problem. Do you guys see how you can develop and use testing based on the anatomy and the physiology? Remember, we work with the anatomy and we observe the physiology. If you take that away with you, you're already halfway down the path. I work with my anatomy and then I observe the physiology. Okay. Now, the other thing that can happen in terms of vascular stenosis is you might not be able to feel the femoral artery because you just are not on a femoral artery. So always do a second test somewhere else, right? Put your finger in the femoral artery. Maybe you just are on the wrong thing. So search around and keep checking. Now, in your minds, if you think there might be vascular stenosis, right? How does the vascular system above and below that area look?